how can parents tell if that emotional dysregulation is sort of is a sign of ADHD worsening, or is it just puberty? And maybe you could touch on the the link with emotional dysregulation and ADHD, sort of what we know would be very helpful.
Yes. So the first thing I always ask about when there is more emotion dysregulation, and it's a question of is this depression, anxiety, or ADHD, is just the context that it's happening, right? So a lot of times kids are perfectly fine when they can do whatever they want, right? So when there is that emotional dysregulation, if it's like with a transition, especially if the transition is from a preferred activity to a non-preferred activity, that can be ADHD, right? Because when the brain is getting what it wants, like it doesn't want to go to something it doesn't want. And then when we think more about depression or anxiety, it tends to be more consistent or persistent throughout the day. So if you do see that transition as being difficult, that's one of the reasons why you would want to think about ADHD. Now, again, that's also challenging, right? Because when kids go to school, they're putting in all that effort in school, they come home. Most people, after they come home from working, they want to relax. So that can be another area that's really hard, especially if kids are not medicated in the afternoon or they don't have something to kind of even out those changes. With puberty, we can see an intensification of that, right? So now all of a sudden, it's not about playing video games or being on your screen when you come home from work. It's like you want to go hang out with your friends. And like, oh, I don't want to come home and do schoolwork. So like those emotionally reactive episodes can be related to the same thing, where it's like they want to do something that they want to do. They were just at school all day. They don't prioritize homework as much as like hanging out socially. So they're going to react more. But yes, it's also normal for kids to be more emotional during puberty. Right? It's just the way their brains are working. And that thrill-seeking drive is part of the reason, because they want to feel good. Like we all want to feel good. And it's just their baseline levels of dopamine tends to make them feel more dull, right? And it's like they really can have more of a reactive mood and they want to feel good. So when they can't do something that makes them feel good, they're more likely to react. We do want to keep an eye out for like depression and anxiety, which are going to present differently, right? Like depression is like when kids really don't even want to do the things they normally would want to do. Right? They're not motivated. They're more withdrawn, and you're just seeing a real change in their mood that's like consistent, like whether they're in school, they're out of school, they're on vacation, can be really concerning. Anxiety is also, it's one of the most common things that we see, and there's different types of anxiety. But because of the changes in the demands during adolescence, we can see more anxiety because kids have to navigate all this, right? And relationships change and kind of like looking for your identity and trying to find your people, like all those things can increase anxiety. And anxiety is also normal. Right? It's like our survival instinct. So like that fight or flight system, if it's related to anxiety, can lead to some of that emotional dysregulation, right? Because it's like you feel like there's a threat, whatever the situation may be, and you react very strongly to it. But that's where anxiety can overlay it with a lot of these different things, and why anxiety can present more and in different ways as kids go through puberty.
Wonderful. And anxiety was number 2 on our list. Tied with that was defiance. So I would love to touch on that. So I guess a couple different things. First of all, you talked very eloquently about how drama and defiance can be a sign, that the brain is just seeking more stimulation. And so one thing is, how can parents not take the defiance personally? And for those parents who also have ADHD, recognizing that, rejection sensitive dysphoria and emotional dysregulation is a real thing that the parents are experiencing as well.
Yes.
And then B, how can we respond in a way that recognizes, okay, this is the brain seeking stimulation, but also it is not sustainable for family life.
Yes. No, again, all of that is really challenging. And just in regards to, rejection sensitive dysphoria, or even like, pathologic demand avoidance, like those aren't like official diagnosis, but they are symptoms, right? They're a constellation of symptoms. And really, when we see those things, we want to understand what they're coming from. Like, are they coming from anxiety? Are they coming from ADHD? Are they coming from just some drama with friends, that is causing more of these emotional reactions? But like the avoidance of demands is also the way our brains work. Like going back to the anxiety, right? Like if our brain is uncomfortable, right? So I talk about anxiety very generally, but like basically this feeling of discomfort or something is not right, or you don't know what to expect. It triggers that anxiety system, which then causes a reaction. The behavior we typically see is avoidance or control. And that's where we can see more of that defiance with kids, right? Because they want to be in control. Parents don't know what they're talking about. I know what's best. And that can create more of that defiance. And again, the question is then, is it coming from anxiety? Is it coming from ADHD? Is it coming from something else? But the way we try to help them is just that communication piece, right? And validating their feelings and trying to connect with them so that they can slow down a little bit, right? Because with puberty and with ADHD, the reactions are much quicker, right? And like, slamming doors or kind of the arguing, the yelling, like it's all part of their brain trying to learn and trying to find pathways into getting what they want, right? But we also need to set clear limits and expectations. Right. So like with the defiance, like even as the refusing to take medication as an example, like if we have good evidence from teacher reports or from what parents are observing that they need this medicine, they do better on the medicine, well, then we have to hear why they don't want to take it and find some sort of compromise. But at the same time, parents need to set the limits. Like, all right, well, like I said, like if you want to go out on the weekends, you got to take your medication all week. Right. Or if you want to have your phone after you get home from school, like you got to take your medication every morning. And that can be challenging because of that defiance. And that's where it really is important to help or to find help through like professionals, right? Because sometimes it's really hard to work with kids because of that defiance. And the work needs to be done with parents, right? So that you can set better limits and you can set better expectations and follow through with them, because our brains all work the same. Like when we're stressed, we want to do whatever we can to decrease the stress. So if our kids are having a tantrum or kind of being like really explosive, sometimes we give in, right? Because we don't like that feeling. And our brain is telling us, well, if you give in, you're not going to feel that way. And we don't want to do that, right? Because it's not helping us, it's not helping them, but it's challenging, right? And there's no like one solution that fits everybody. It's really just understanding this situation or the patterns, I should say, that are resulting in those behaviors and then intervening in a way that kind of changes them.
Mm-hmm. Yes. And, I don't think I need to tell anyone here that this increase in impulsivity and risk taking is absolutely terrifying at a time when your child is seeking independence, seeking a driver's license, has access to perhaps substances. It is a minefield. And it's absolutely, it's absolutely terrifying. And so I guess the question is about boundary setting and then the, how to enforce the consequences that you establish with your teenager when that teenager can get up and literally drive away.
Yeah. Well, yeah, I mean, that is always a hard conversation, right? Especially when it gets to the point of like aggression, or just like not being able to contain them in the environment, because you don't know what to do. And like I said, there is no one way. It's just like, what can you do best in that situation? When kids are escalated, right, or kind of really dysregulated, like the first priority is always safety, right? So like if you can give them space and it's safe to give them space, you try to do that, right? Because all of us, parents included, like we don't make the best decisions when we're heightened, right? Like when we're feeling big emotions, and it's just adolescents, they feel those emotions much more stronger, right? And they have less control over controlling the reactions. So if we can try to de-escalate and calm things down, and even just say like, all right, I can't talk about this right now. Like I'm going to come back and talk to you in like 10 minutes, right? Or I can't talk about this right now. When you're feeling better and you want to talk to me about it, please come. And again, that's not always going to work, but like, we don't want to escalate things with our interactions with them, right? So like, wrestling over the phone is usually not going to make things better, right? And that's where like really professional help is the most important, right? Like even like when we talk about like mindfulness techniques or, some of the DBT skills, having a good approach and being mindful of what's going on in that moment can be really helpful. And that's where the validation it can be really strong with kids, right? Understanding how they're feeling, acknowledging it, not arguing with them about it, and then just trying to help them calm things down, right? Because when they're calm, they're more likely to do that. And I see a lot of kids where they have these big episodes, they're saying they hate their parents or they're threatening them. And then like after they're calm again, they feel bad, right? Because it's not like they're choosing that behavior, right? The brain is driving them to do that because of whether it's, the impulsivity or kind of the big, strong emotions, or even, some of the risk taking. Like they don't see the risks the same way parents do, right? So there's always going to be that conflict. Like they're going to be like, well, there's nothing wrong with that. I did that last weekend and nothing bad happened. Like, well, but that's because nothing bad happened last weekend. It doesn't mean things won't happen bad the next time. But they're not seeing it that way. And that's where us understanding that as parents and also kids understanding that is important.
Yes, that also short time horizon of the adolescent brain. Okay, we have a lot of questions regarding medications. I would love to turn to that. And you spoke about the fact that it may be appropriate to adjust girls' medication due to the hormonal swings of their monthly menstrual cycle. A number of parents of boys wondering, is it normal and expected for medication to begin working differently, maybe not as effectively, or new side effects to emerge during puberty? And along those lines, what would be some signs that it's time to adjust medication or consider medication?
Well, whenever we're thinking about interventions in general, like, is there impairment? Is the behavior, the symptom interfering with something? And if it is, do we need to address it? And then how do we address it, right? So some kids, they can get by, right? We see this a lot. We see this a lot with, the attention piece at school. Like, so kids that are really bright can kind of put in the effort and the energy and do well in school. It's just they're doing it with effort, right? And sometimes that effort is exhausting. So like a kid that's doing well in school, where we don't really see impairment, maybe you don't need to start medication yet, but you always want to keep close eye on if anything is becoming more difficult, right? So as an example, like if a kid has trouble with impulsivity or hyperactivity or attention, and they're really putting a whole lot of effort in the school day to kind of maintain themselves, they're more likely to react and be exhausted by the time they come home, right? So like if they're doing well and then we see a change in behavior, that may be a sign that, all right, maybe we do need to start medication. Or if they're on medication, all right, maybe we need to adjust it. As far as the role of testosterone in the effects of medication treatment on boys, like there's not a lot of evidence or studies to kind of look at that. We do know that the increase in testosterone will increase impulsivity and those risk-taking behaviors. Like as kids go through puberty, sometimes the hyperactivity gets better, but it's always a mix. So there's no studies that I'm aware of right now that say just because you're going through puberty, you need to make adjustments, right? And that's the general rule of thumb. Like we only make adjustments if we're seeing a problem worsen, right? Or a new problem presents, and then we're trying to focus on what's the best intervention or the best medication to treat that problem. As far as the response, like, yeah, that can change over time for the reasons I mentioned. And we want to make sure it's the right medicine. And sometimes, like, there's not a lot of, different stimulants. Like the biggest difference is, how long it lasts or kind of how it's absorbed. But for the most part, methylphenidate medications are methylphenidate. Like there is Focalin or dexmethylphenidate, which is kind of like a more specific version. Like all other Ritalins or methylphenidates are like a mixture, right? By just having the right-handed version of the medication or methylphenidate, some kids respond better to that. Some kids will have less of a reaction or side effects from it. So it's always worth trying that if somebody's been on methylphenidate or Concerta for a while, and you want to try something that's the same class but slightly different. But then it's always about the duration, right? So Concerta tends to be the longest lasting of the methylphenidates. So it all depends on how much time you need in the system. And then we also want to consider side effects, right? So like Concerta, if it is effective and lasting longer, well, that may mean a kid is not eating for longer during the day, right? And then there may be more of a crash at the end of the day because they didn't eat all day. So it's a moving target in the sense that you're trying to figure out what the problems are and the best way to address them. And then, if you're on like a methylphenidate medication that's not working well enough, you can consider switching to the amphetamines, which tend to be more powerful as far as how they stimulate the brain, because both methylphenidate and amphetamines help like recycle or reuse the natural stimulation or dopamine that's floating around in the brain better, whereas amphetamines actually increase the release, right? So it's kind of like effective in a more powerful way. And that may be a reason to change, right? Like if you're seeing a loss of the effect with a methylphenidate and you need to try something that works better. And then there's the non-stimulants, like so atomoxetine and Qelbree is a newer medicine that's very similar, but those are things you can consider too if you're not getting the optimal response from stimulants themselves.
I don't think I've heard that differentiation between the methylphenidate and amphetamine described in quite that way, and it makes so much sense. Thank you. That was really clarifying. One more question along these lines. A number of people saying in the chat here who are saying, I thought medication was really only to help with school time. And if my kid's doing okay, should I consider it? I wonder if you could touch briefly on some of the preventative benefits of medication and a little bit about what we know about preventing the risk for things like car accidents and even self-harm and risky behaviors. I think it's important for parents to hear about that.
Yes. Well, yeah. And again, that's like taking that step back, right? Like looking at like their well-being in general, not just like how well they're doing in school. I've actually had some teenagers that have been like, yeah, I'm definitely taking my medicine like when I'm driving. Right, because they realize kind of what's going on. That's why the communication is also important. Like understanding what they're experiencing because of the ADHD, because of the the medication, and just giving them the tools that they need. I typically recommend giving the medication if there's something it helps with, right? So weekends, school breaks, or summers, like if they don't need it to do well, then they don't need to take it, right? And it's not bad to not take it. It's not bad to take it every day as long as they're tolerating it okay and you're seeing some benefit. But, you know, as far as that regulation piece, so that would be a symptom, right? And if that's causing interference in their function, then you may want to give it to them, especially if they are an adolescent. They are out on their own more, right? And you want them to kind of make better decisions. You know, so if you see that benefit, I typically recommend that you continue to give it, especially if they're tolerating it well. The bigger challenge with that is the timing, right? So as kids get older, like, you know, teens, they tend to go out more later, right? And that's always hard because the stimulants, especially the long-acting ones that we use mostly in school, like they're going to be out of their system. And then if they take a booster or not, like it's only going to last a certain amount of time. So there's always going to be, with stimulants at least, this period of lack of coverage, right? And when there's lack of coverage, you're going to have those symptoms: the impulsivity, the inattention, the decision-making problems, the big reactions, and that can be challenging. But that's where medications like, you know, guanfacine or clonidine come in, or even, you know, atomoxetine. Like they can cover the whole day better. And if they do, as far as the impulsivity with the alpha agonists or the guanfacine, like that can be helpful, right? You know, so they're not so impulsive, so that maybe they're slowing down a bit. It doesn't help with attention, right? The alpha agonists, but they can help with the impulsivity and the behaviors and help things be calmer. And specifically, those medications work on the sympathetic nervous system, which is that fight or flight system, right? So some of that impulsivity or the hyperactivity can come from that system being activated. And if they're in a stressful situation, that's the system that gets activated, and that's the system that can trigger that fight or flight response. And unfortunately, with boys and testosterone, it tends to be more of that fight response. You know, so that type of medication may be helpful to kind of even things out throughout the entire day.